over the last 2 weeks, especially with the practical presentations, and prepared this for you. So actually, the first couple of slides are are actually a repeat of what we already showed to you. So we're not gonna really talk about each slide. I mean, I'll be honest, we could speak forever about a lot of these things and go into really detail into many aspects. But what we try to do is we try to collect the start of the resources for you, and a lot of an advice for the 7 steps plus the 8 that we've been discussing for the in this course. So we may actually go through slides very quickly. You will receive all of this. You'll be able to read it through on your own, digest, and we also hope to actually find a way to keep in touch with all of you, so that all of us, not just you with us, can discuss any questions that you may have and ideas and other resources that you may know of. So, but for the sake of logic, I actually did copy paste here the initial slides from our previous session, just to remind us, you know, of what a difficult situation we're working on. It's not just a matter of the fact that this is an emergency response, but also that really there's very little evidence that we're working with in the ground, that we need to really be thinking about people's behaviors and how people are affected by the amounts of information they receive and the misinformation, and that we absolutely do need to reach out and speak with people of different professional backgrounds. I won't go further into these discussions here. We heard them in your pitches very clearly. I mean, the key messages that we've been discussing in class came through. Your reflections and how you prepared your pitch to the minister. Now, what also came very clear from your pitches was also this key message that we really need to be thinking about not necessarily discrete products that we're trying to achieve and deliver in a certain amount of time, but there needs to be a strategy behind that. And trust is definitely one big component that we're all dealing with, but it's not only trust in the minister, it can also be in a ministry of health and health authorities. It can be also into the health system, trust by different communities, trust in the messenger, and that, you know, that can be very philosophical as well. So really good job in your pitches addressing this. So just to remind us, so what we've done with Liz now is we compiled for each of the steps, and this slide you've already seen, we've compiled a suggestion of basic ground truths that you need to be adhering or thinking about when you're thinking about that step, working in that step, and also best practices to achieving that. And then we are guiding you to some tools. And, you know, this lecture combined with everything else that you've received in the course is actually a really good start. So let's try to run through some. And again, I'll try to, so Liz, we have about 10 minutes per step. So let's try to keep the pace. And again, really sorry for the death from PowerPoint to all of you, but the point of this presentation really was that we could also give you something in writing, that even though we don't have strategies and training manuals and a lot of papers written, because things are evolving really fast, we wanted to give you something to share and that we can shape together through our experiences going forward. So we're in step 1. And this has to do with social listening. So there's 3 social listening truths that Liz and I are proposing to you. One, that there's really no such thing as a magic infodemic dashboard. Claire was also mentioning this as well. Now, this doesn't mean that you discount technology, not by any means, but you really do need to think about how you use technology for either filling the data gaps or actually bringing about behavior change, which is different than just producing technological products or dashboards. Even if you work really fast, please be committed to the evidence and the core principles of monitoring and evaluation. This really is key. We will not be able to, even 3 months from now, have any better recommendations if we are not consciously having evidence, having this commitment to collecting evidence rapidly and using it. One other truth is that it's likely that you'll need to manually compile multiple data sources from multiple platforms. And that means that you, as the person, the analyst, are at the center of analysis. And this is why, while we were teaching and giving you hints about different tools that you can use for different purposes, in the end, the decisions that you as the analyst or you as a group decide on principles of how you will be integrating the data and how you discuss an integrated analysis is really, really important. The third truth is about social listening. And again, you get this phrase repeated quite a lot, but really the point of all of when we're saying social listening is also not a process and it's not an end product. It's is a process. It's really not an end product in itself, because we've seen also, you know, in Elnor, but also through all of the lectures, the way that one can really make human-centered interventions and connect with people really means that not only do our messages and activities need to be very tailored to communities in a variety of forms, but they also need to be very nimble and they need to adapt, because the needs of different populations, different communities really change over time, and we need to be able to detect that, understand that, and respond to that fairly quickly. What you also need to be aware of, and there's still a lot written here, but this last bullet, do remember that factual information can also be repackaged and weaponized as misinformation. And that when you're, you know, doing analysis and detection, that actually misinformation can be expressed in such a way that you won't be able to easily detect it through even AI and linguistic means. So when you're trying to, you know, understand what the communities are talking about, you really need to be aware of the shortcomings of the current methods that are in place and how you're still going to be able to piece all of that feedback together. This is where partnerships and improvement on tools, but not being afraid to work with imperfect data really comes in. Liz, 1 minute comment on this, and then you take the next slide.
Yeah, so all this to say, we're giving you a book in a PowerPoint format. So we know it's a lot of text on these slides, but just to indicate that you really are striding into virgin territory as infodemic managers, and there's not a lot out there that exists already that you can easily pull from. You will have to end up cobbling or Frankensteining together different tools and resources to help you measure the infodemic and come up with strategies to address it effectively. That's okay. Just acknowledge everyone else who's here, who's working in infodemic management, is in the exact same boat. But there are a few things you can do. So first of all, you can set up your search terms and research content taxonomies. This is really integral as a starting point. There are research content taxonomies you can borrow from. There's different search formats, and there's different classifications of content types and types of misinformation you can borrow from. You want to have like some sort of logic to how you are categorizing information or misinformation that you come across, because ultimately you need to be reporting back on not just narratives, but numbers. That usually having both of those things is really helpful when you're trying to communicate about infodemic management and what is it that you're trying to do. So measure the infodemic, but then also explain what the narratives are that come out of that. And looking at taxonomies can help you figure out where things seem to be headed thematically. You can also subscribe to relevant news sources that already exist. I mean, seriously, one of the most useful, powerful tools you can do is just sign up to Google News. There's many newsletters, webinars, Google Scholar alerts, mailing lists, RSS feeds, you name it, that already exist on the topic that you're interested in. So it costs $0, but sign up for everything that you can get your hands on that is related to your topic of interest. And encourage your colleagues to forward to you if they come across something that you would find interesting. That's also another great way of discovering content and approaches. And you want to make it a habit of regularly checking in on your contacts and channels and platforms that you're trying to listen to. Make an effort to understand information, content, and opinions beyond your filter bubble or echo chamber on a specific platform. We remember that Facebook and other platforms will only serve us up what the algorithms think we want to see, which means that we end up seeing stuff that we tend to agree with and sharing stuff with our friends that they tend to agree with. And so really you need to make an extra concerted effort to go outside of that bubble and understand how other groups and other people are thinking and feeling and sharing information, even if you don't necessarily agree with that information on a personal level. And just recognize that there's many different norms and communication styles and features of different platforms. It's really important to understand how to use these platforms to share information and how to react to it. So you don't need to become a social media genius, but you do need to be familiar enough with social media platforms and how they're used to be able to come up with recommendations that are actually make sense. And then it's of course really important that you maintain that human relationship with your colleagues, contacts, and collaborators. I mean, that's a given. So much of what you're doing is straight up public health diplomacy. It's building and working within relationships that you have with people who have access to data or insights that you need. Tom also dropped into the chat box the weekly RCCE newsletter. Highly recommend you subscribe to that. That is a useful tool as well to have in your toolbox. Tina, do you want to talk about tools?
Sure. Yeah, we also have the infodemic management newsletter, which is a little bit broader, but absolutely get your hands on all of the resources that you can. So we ran down the list. There was a lot of discussion and a lot of questions on Miro for particular tools to do something. And instead of actually linking to all of these, we're literally listing them here for you. Some of them are free, some of them are proprietary, which means that you may get access to them through your workplace or where you're working, or depending on who had made decision before you arrived to be using them. But these are the types of platforms that you would be looking at for social media, web, and media analysis. Where you would get data, for example, from the health system and about different communities. All of this is really good resources. So just remember, like we were talking, all of these tools were designed for particular purposes, and it's really your job to try to figure out, well, how do you then apply those data and data sources and analysis to what you specifically need to do. And you'll see here really from the list that the variety is very diverse. And take a look and see, what you're interested in and what you need to do, you're going to use. Most of the tools that we're going to be listing have a ton of online communities where if you Google, you will find tutorials, you will find people that are specifically discussing only that one tool. And this is something that also needs to become a habit for you. You will need to do your own research and find those people that are specifically specialized in one particular tool or not, and then critically look at how you're going to apply them to your work. As far as research methods and data collection tools, this is really not exhaustive, but there are some tools and some research approaches that you can get a start on. And these are really just the basic, because they then really are being applied in many different contexts, and you can seek out people that are using these. So we recommend absolutely checking out betterevaluation.org if you want to get a grounding and practical tips on anything related to monitoring and evaluation, so that that is the place to go. Another really good tool to get you started, just to think about how to research through survey format behavioral insights for risk communication, specifically in COVID-19. We're sharing here the WHO European Cosmo tool. For collections, be creative. We are putting here even Amazon Mechanical Turk, which is crowdsourced capacity that you need to do something quickly. So don't think only traditional, because that will not make infodemic response fast enough for what you need to do when you're trying to get the data. And remember all of the other discussions that we had related to this. I will, at the end of the session, speak about specific services that some of the UN agencies are providing to UN teams and partners. For this reference, for example, to UN Global Pulse related to social listening, I'll give you some more resources at the end. And then, of course, data analysis and visualization tools, whatever you can learn to present and communicate your data better, even better. I will skip through this really. Maybe point out a couple of things. The data for good data sets that the Facebook colleagues described to us, the larger data sets that they're working with the global community on. This first link under some examples is actually quite useful for any of you that are searching for basic knowledge, attitudes, and practices surveys for your country. There's all kinds of limitations to the data set, etc., but it is very useful, and I wanted to point this one out. And there's one link that actually is not here, and I'll speak about later, which is that WHO had just kicked off a project for online social listening, automated social listening using AI that will actually have country-specific data as well, which, you know, when you start looking for data sets, do your own research, but there's some things that we already can guide you towards. And this is only a start of learning resources. If you combine them with the rest of the material that you received from all of the instructors, you're quite well set and on your way. Liz, shall we go to the second step, which is deliver high quality health information piece?
Absolutely.
And maybe you do the truths now.
Sure. All right. Some truths, hard truths. So there are 3 of them for delivering high quality health information. 1, design content in a way that is useful to the end users so they can reshare, repurpose it, or adapt it. So guess what? We're no longer living in the time of poster printing and PDFs only. We need to be designing for mobile first. We know the vast majority of humans now on the planet are accessing health information via their phones. So you need to be designing for phones and not necessarily for desktops. I also indicate their posters won't save us. Very important. Really answer the questions that people are asking. The number of times I've edited content where there's been a group workshopped 3-sentence response to a question that doesn't actually answer the question that is being posed. That's problematic. We need to give people straight answers to questions that they have. And it also needs to be formatted in a way that when someone types that question into a search engine, your answer pops up. And we'll talk about that a little bit more when it comes to, and we've talked about this in the fishbone exercise about, search engine optimization and the meta tags that you're using, and even the shape of the markup language that you're using will all have an impact on how people find your information. And that's really relevant here. You need to consider that. It's not just about the words and deciding on the words and the images. It's also how are you making sure that this is being plugged into a format that people can easily find. And so consider readability, accessibility, visibility of content for different audiences. People read and consume information differently depending on what kind of device they're on. And this is really important to consider. You assign that your content is successful when it has been reshared.
Okay, I think it's not just me that lost Liz. So I'll continue and hopefully Liz is going to come back. So yeah, the most important thing, in addition to what we know about, and what we're currently doing with the pushing out of the high quality messages, is that we really, and this is what Liz was starting to talk about now, was that we really need to design content in a way that it will support content syndication and reuse. And there are best practices online related to this. So it's really critical that when you're thinking about rapid content development and deploy and dissemination, which is what also Halim was talking about in Africa Infodemic Response Alliance, all of this content needs to be enabled to be crawled and integrated into search engines almost immediately, and social media platforms. So it's not just enough to say that you're going to be pushing your content out and putting it on the website. That's actually not the point where you're putting it on the website. Most people will find it through completely different communication channels and different access points than coming to your website and looking at it. So this really, it really cannot be underestimated how important it is that well-formed content is then publicized on your website in ways that it includes appropriate metadata, tagging, headers, very clean code, and it's optimized for search engines. And Claire showed you some examples also from health authorities, even WHO, where this is just not the case yet. And it's something that does need to be paid attention to. So really, please do pay attention to this. The editorial style and writing metadata is really important in how we actually see this information online. Liz, I see you're back.
I'm back.
You want to take the third one?
Sure. And so here's the thing. Creating and disseminating high quality content requires promoting reliability and credibility of source. Don't add to the infodemic by pushing out lots of content if people don't recognize you as a trusted or credible source. This is why those two things are very important to keep it connected. So you need to be consistent across platforms. And if the message changes, there needs to be a clear reason for it, and it needs to be time-stamped. So that is really critical, especially since we know that guidance around COVID-19 is changing on an hourly basis. And we already showed you an example from viral facts in Africa, but there's a lot to be said for establishing a common brand shared by partners and using multiple brands by multiple segments in the population. We've seen that sole source content is much more likely to be weaponized. Shall we go on to the next slide, Tina? All right, so here's some things that you can do about this. Best practices. There's 3 of them. Designing content with an eye, again, to be remixed, reused, and digitally distributed. And there's a lot that you can do to speed up this process. Remember, speed is the thing here. You can create templates that have a consistent branded editorial style, design content for channels where your audience is already engaged on. So go back to Neville's piece of advice on day 1. Go where your audiences are. Consider releasing content under Creative Commons or public domain licensing so that it can be set free. And then before you set it free, make sure it's tested. So when possible, pre-test your materials with your members of your target audience and validate your translations of content. This is very critical. Don't rely on Google Translate to save you. When possible, use A/B testing approaches to understand which messages are really resonating. And then consider about how you're measuring the effectiveness of your messages and not just their reach. It's very nice to say, oh, yes, we had 20,000 impressions of this particular Facebook post, but that doesn't tell me anything about how people engaged with it. If they engage with it at all that tells me is that it showed up 20,000 times on someone's feed. And so you can consider impressions, reactions, shares, and measures of when messages jump from platform to platform, or if it's been repackaged or reshared. And we gave some hints earlier on, and I think this was also highlighted by Claire, that often you're not going to have key messages just copied and pasted over and over again. It needs to be recontextualized and rewritten for specific audiences, but they should rhyme. And then ultimately, you want to integrate successful message frames into further message dissemination. This is really important. Build on what seems to be working and stop using the messages that don't seem to be working so well. All right. Anything else on this, Tina, that you can think of?
No, because we actually don't have the time to read all of the bullets. Really sorry.
All this to say, we got a lot of tools and resources to help you here.
Right. And if you're not comfortable necessarily with content syndication, here's some tips on what you can research and what you could do. And these are more things that you need to research, not necessarily here's a tool and you apply it. These are really principles and partnerships that you're trying to build. Information and data sources. In this particular step, we looked up more learning resources, but really the information is going to be Ministry of Health, other ministries, WHO and UN agencies, and this is who you need to be speaking with. Right, so step 3, and this is more the health system public facing, no, health system facing part of the steps. Applying interventions, toolkits, and methods. Just to remind us, this was the step. And what are the truths about applying interventions, toolkits, and methods? So really, and this is what we've been saying all along in the course, there's really few out-of-the-box interventions that exist for infodemic managers right now. And this is specifically because of the lack of evidence and implementation and operational research. Which means that you will have to innovate on your own. Try to develop interventions that are based on evidence, but really think about, as we say here, building fast and ugly, roll out quickly, learn from the experience, iterate. It's really important that you're comfortable with this, and you'll see that many of the colleagues and the existing structures may not be, but this is something that you in your mindset try to achieve. Really learn from experience, learn from colleagues. Sometimes things will not be written in literature. It's something you will find out about particular approaches through your network, professional network. And this is really key. This is why we also want to, grow the community that we've started now with you. So what's really important here is that whatever your decision is regarding the intervention, that you still have a logic behind it. And work backwards. What's your actual goal? How is your intervention going to address that or improve the response to it? And how will you know? So this comes back to the measurement piece. So make sure that you from the very beginning have this logic in place. And this actually is something that you do need to write down, even if you sketch it out, because it will guide also how you measure and figure out if it's working or not. Another thing regarding intervention design and deployment, you will always have insufficient funding. Especially in infodemic management, where there's really no clear box or budget line practically anywhere for this piece of work. So make sure that you are comfortable with cheap and fast tools. Lean into partnerships and collaborations, build them, and don't be afraid that you're not an encyclopedia of everything. I mean, there's a reason why Liz and I are collaborating on this course. Actually, we come from very different backgrounds, but we've also met each other in the middle quite a lot. And what we're doing now over the course of the last 6 months as we're basically expanding the knowledge of within that middle. We complement each other's work and projects, but really over time, you'll see you will actually learn enough about every topic so that you'll be able to know what you don't know, so that you know who you need to seek out, and you'll be able to speak across disciplines more fluently, which means that you'll be able to be a much more effective glue. So don't be hard on yourself. Be forgiving. You will learn a lot as you go, just like we do in our own jobs, and be open to cross-disciplinary work, to really people that are usually not a part of the partnerships. Liz?
Yes, this goes back to a Liz quote: "We are giving you enough to be a little bit of dangerous." And I'm giving you a lot of links and resources and tools to be even more dangerous if you would like to be. But really, you don't need to be an expert in all the things, just know enough to be able to figure out how to connect the dots. There are a few things you can do to help you get there when it comes to applying interventions. So form a small team that you can work with to help develop the ideas. It's always way better to have more than just one brain involved in this process, because you're much more likely to have ground truthing and different skill sets and different perspectives to ensure that the idea that you're developing isn't just a great idea to you, but could be a great idea to more people than just your own self. You need to be building quickly. We are in the middle of a pandemic. Don't get stuck in process. Sometimes you just have to get stuff done. And again, do the things that are the most immediate, highest priority for your Ministry of Health counterparts. That is how you can build value quickly. This is also another favorite Liz quote: the definition of insanity is repeating the same thing over and over again and expecting different results. Creativity is encouraged. And when you're introducing a new innovation, really make sure that you've identified how you plan on rolling it out. I have a big problem of people identifying a problem, but not either proposing a solution that there's zero funding for, or proposing a solution that is not practical. So really consider, like, if you're proposing a solution, part of that solution is how you're going to make sure that there's budget and adequate support to make it happen. And then be participatory as possible with colleagues, target communities, and partners. Again, the more brains involved in this operation, the more successful you will be. And really consider implementing interventions that are participatory in nature, from its design to implementation, use, and measurement. And then always question your assumptions about the populations you're trying to serve. The road to hell is paved by assumptions and good intentions. So be mindful of all the dynamics you need to be considering from intervention design and rollout. And you can rarely go wrong by listening more to the people you're trying to serve.
So we collected here some more ideas on ideation and intervention development. This really comes down to either an example of a process or an example and approach that helps you really design with communities and in mind, and apply ideation and human-centered design processes as well. There's a couple of techniques here, and we absolutely do recommend that you flip through here. Under implementation operational considerations, we threw in a little bit of health literacy and behavioral considerations for you as well. So lots of things to do to follow up on. And learning resources, this is a few related to intervention evaluation specifically, actually, and taxonomies. So the fourth step, countering misinformation and disinformation. And again, we could speak a lot about this. So what are the key takeaways about countering misinformation and disinformation? The trick here is that we as infodemic managers, we do need to keep emphasizing and communicating in effective ways that there will always be too much information, including misinformation, in the whole information ecosystem. And you practically, as a technical expert, will need to focus your work on those parts of the ecosystem where you will have most impact. And the only way that we can then start being more convincing about our work is if we then have evidence and examples of this. But people are still catching up with that idea, and also what would be the criteria to prioritize how to influence the information ecosystem. It's a beast, and it's grown the last 20 years. So recognize, when you're thinking about where to intervene, keep in mind that some types of misinformation are more harmful than others, and really our guiding principle is minimize the harm or prevent the harm. Definitely understand the relationships between the different stakeholders that are involved in the fact-checking, health communication, and amplification of the messages, and really do keep considering, even if there are blind spots and unnetworks or closed populations may not be any data on, do not forget them, and devise strategies and activities through which you will research their needs and engage them in design of interventions. they may be very much exposed to misinformation in very different ways, and they may also be affected very differently than what your assumption may be. The second truth that Liz and I put down was that absolutely pre-bunking is just as important as debunking. There's quite a lot of current conversations online and by different influential, leaders that are specifically looking at debunking and countering. And as you've seen in the training, that's only some of the story, and it could actually lead also to. First of all, we cannot debunk as fast as misinformation is appearing, but it has to be done because it keeps the information ecosystem healthier. But what we really need is to actually pre-bunk and raise the resilience of individuals and communities to misinformation. Only by working at it from both sides, you'll really be able to work at it. And what we want to really point out here is that in order to pre-bunk, you really need to have a much deeper understanding of the information environment, the ecosystem, the types of misinformation, the narratives, etc., than those that are concerned only with the promotion of the high quality information. Both of these activities need to be done, but pre-bunking is much harder and requires a lot deeper understanding. And then, of course, what we do, the tipping points and the decision points of what you do in each country and when you react, that will really depend on country to country, on individual contexts. That's why it's hard right now to actually be giving you a lot of examples, because we need to actually get a lot more experience written up and shared. So these are some of the examples of why the context in countries is different, and it can be linked to anything from Ministry of Health having a very different tolerance for a certain type of misinformation in the environment, to also the different priorities that the Ministry of Health may have. And your job really can be to identify in that particular local context what would be the pain points through that would then help decide these priorities as well. Liz, do you have any other comments?
No, you hit the nail on the head.
So please take us to best practices.
All right. So again, this goes back to choose a taxonomy of classifications for mis and disinformation, stick with it. You need to be systematic in your approach. Otherwise, you're just randomly firing shots to try and debunk stuff, but you're really not understanding the larger thematic issues that are emerging. And this means that you need to be thinking about which fact-checking platforms you're using, and then the types of new mis and disinformation that you're tracking. So you'll have to update the taxonomy over time, because there's always going to be a new kind of fresh concerning issues that will be cropping up. And one of my favorite insights here is, when in doubt, be a lumper, not a splitter, which means clump together when you can, lump together different categories. Instead of having 100 different categories, it's better to have maybe like 15. Because it's going to make it much easier to then analyze. The next thing you really need to be considering is the strong partnership. Fact checking cannot be done in isolation. It can only really be done in strong partnership between fact checking organizations or organizations that have fact checkers, and ministries of health, WHO, UNICEF, and others who are working in the space of the media. And so just recognize everyone will have different access to tools. And it's also really important that when you're debunking, that the content and the tone that's being used to debunk, it's matching the original information of the. So you would really want to make sure that things are matched well. If a debunk happens in forest, is anyone there to hear it? Make a plan for dissemination of debunks. Just because you're posting a PDF on your website saying, look at all the great misinformation we've debunked, here's the PDF. I've seen variations of that theme. That's not terribly helpful if you're not pushing out the debunks through the same channels through which the misinformation came in through. And then really where you can harmonize. And ultimately, you really need to be reporting out on key insights on major misinformation narratives, because that is actionable information that ministries of health and others can act on. And if there are information voids that are detected, make recommendations on how to fill the void. So to give you an example, if there's tons of questions around vaccine side effects or vaccine safety of a vaccine, but there's zero information about those vaccines on the Ministry of Health website because there hasn't been an officially approved vaccine. But you continuing to see misinformation and disinformation and questions about what's in the vaccine and safety profile, that's a gap. And that needs to be addressed. And so those are the types of gaps that you want to identify. And so then there can be content developed to address those gaps.
Mm-hmm. So a bunch of resources again, lots of really rich ones, and especially in this topic, First Draft has some really good articles, but other partners as well. I'm pointing out here a couple of things. So you've seen the fact-checking tools from Google. There's another resource that I'll actually give you a bit more introduction to later. By Ryerson University. It's a collaboration between WTRO and Ryerson University, where they're actually taking the Google data about the fact checks, the claims that were fact checked that you saw in the Google session, but they actually made visualizations and further analysis that make it clearer by country or by topic of what is actually circulating and what has been fact checked. So COVID-19misinfo.org is a really, really good resource, and they keep adding things and information to it. And then another really important source of information for you is Pointer, who are basically the seat of the International Fact-Checking Network. And here's some learning resources for you as well. So if you move to step 5, the monitoring of the environment and responses. So after you've implemented the intervention, how are you then measuring and estimating the impact of the interventions, and what are your recommendations from this? So keep in mind, it's really important that you learn from what you're doing and that you course correct early. And of course, what's the three truths that we came up with here is, sorry, measuring infodemic interventions is inherently hard. And for different reasons. One, because there's no standard indicators that you can easily refer to. Then most of the time we measure things that are simple to measure instead of those because it's just easier to get the data. And even if you end up developing some proxy indicators, meaning that you're measuring some indirect measure that could inform you about how the attribute that you're trying to measure is changing. You really need to, especially if you're putting assumptions into your measurement and what you're measuring in relation to your intervention, you really need to make sure that you evaluate them, how they're working, and if they're even appropriate. Even in evaluation frameworks, you need to check your assumptions over time when it comes to indicators. We discussed the second point very a lot in class. Yes, you can only measure the tip of the iceberg, what's visible, either because the data is available or what is measurable. But you really do need to be aware that you only can collect what we can measure about people's behavior online and offline. So it will always be incomplete and not representative, but this does not mean that you cannot work with this data. That's why you need to be in your head as the analyst and as the driver of the integrated analysis. You need to have a system and a systematic approach in place, not only to how you organize that information, but also how you apply and monitoring evaluation principles to every single integrated analytical exercise that you do. So there are people that you will need to train others about the fact that incomplete data sets are okay. And even, if from an epidemiological point of view, some big data set may be biased, etc., and not representative, that does not discount these types of data sets at all, because the principles of what we're dealing with, especially when we're dealing with qualitative data or big data sets online, they're all valuable. We just aren't used to working with them and integrating them together. And this is where multidisciplinary teams really come into play in integrated analysis. Liz, do you want to talk about M&E, and it shouldn't be an afterthought?
Sure. I think the most important point is the first one. There's a direct correlation between the strength of your collaborations and partnerships and the diversity of data that you have available to you to the usefulness of insights you generate and your ability to counter and course correct in the infodemic. It can be very tempting to collect all of the data, but then you're just drowning in data, and it can be really difficult to act on. And so thinking about the monitoring evaluation process really as you can think is acting, and how are you measuring when you think about input, process, output, and outcome measures. There's entire suites of tools available out there for you and trainings, which we have on the next slide that talk about M&E basics. It would help you, and it would help the people you're working with for you to gain more M&E skills, because the more that you can measure what you're doing, the more meaningful your results will be, because it's not just your opinion. It's there out in black and white. You really also need to consider the cost and burden of data collection. There's so much data already being collected. People are overwhelmed. The last thing anybody in the field wants to hear is like, oh, we have this other form we need you to fill out, right? So just consider that, that's really unsustainable. You also want to remember that national level data is generally not very helpful for infodemic management because it flattens everything into a straight line. There are very few countries on the planet that have a super homogenous population where everybody is exactly the same and everyone has the same feelings and attitudes and is living in the same infodemic. We really need to focus on subnational data collection and use. And that means thinking about tailoring your monitoring and evaluation approaches subnationally whenever you can. And the closer you get to community, the better. All right, so what are some of the best practices? You need to really build a culture for evidence-informed response and recognize that you'll often have to play as an educator and as a manager in these roles. Bring people with you. That's how you want to do it. Whenever you make a point, be sure to underscore it with data as much as you can. And you all have done a fantastic job of doing that in your Eleanor pitches. The more where it's just based on anecdote and opinion, the less seriously people will take what you're doing and what infodemic management is about. And so there are ways to think about troubleshooting mismatches between data sets, indicators, and insights, thinking about harmonizing with at least a core set of indicators and methods that are more efficient and nimble. Again, instead of monitoring 30 things, just monitor 5 and see how well you do. And you can also start putting things into issue briefs and to regularly reporting out on what you're learning. And always ask yourself the question, how do we measure this? How do we know? If you're missing a data source, find other data sources that approach the problem from a different angle. It probably exists out there somewhere. You also need to understand it's not just measuring the amount of information, disinformation, but also what kind of harm and the amount of too much information. So looking at questions like, do you have sufficient information about COVID-19? And then you look at the percentage of people who say, no, I have too much information. Then looking and understanding, well, how is people being overwhelmed with data or information affecting their decision-making? And so these are just some of the considerations you need to take on. You also need to be thoughtful in countering your strategies by aiming for a wide distribution of the counter and ensuring that it reaches the communities where misinformation was circulating. Again, the last thing you want to do is post a PDF of your debunks on the Ministry of Health website and be like, right, we did the thing we debunked. That's not sufficient. You also might want to consider community level data collection to understand what is the community level impact of some of the work that you've been doing. If you see a downward trajectory of queries or questions on a related topic, this does not always mean that the counter was the reason the question stopped, right? So that is not necessarily a correlation. And so you need to consider as well that there will be waves of when narratives seize and then will just naturally live their life and then die without any outside intervention. And so really tracking what you're doing and kind of the crest of the wave of the infodemic curve and learning that over time and mapping that over time will help you understand, well, what seems to be working or not working and how are these two things related to your efforts versus the infodemic writ large. Tina, do you have anything else to say on this, do you think?
Yeah, I mean, this is the difference between, working in the response when you're trying to support you know, when you need to really have a finger on the pulse of what is actually being discussed. So this came out, for example, in the lectures from the Google and Facebook colleagues, right? Because they were focusing more, okay, I'm subscribed to this thing every day and I get an email, but then I also check the dashboards like every couple hours, what's new. And, you know, you end up getting a feeling for what's actually happening. But when you're trying to do things on and devise a strategy of how you're going to be managing your program and what you need to be prioritizing, then you need to actually start looking at how do you in the long term separate what is actually just a natural fluctuation in the narratives versus what is really gaining traction. And what we try to give some indication to you of how you would do this, but you'll always have this competition of two viewpoints. One is, okay, this is a narrative, like a very short view, this is narrative, something is gaining traction, we need to do something about it. And the other is, what is the all information ecosystem doing? And am I blind to something because I focused so much on one particular narrative? And how does this narrative relate to everything else? Am I prioritizing the right thing, for example? This would be my other suggestion, but we'll share this with you and you can sort of digest and think through what we've written. So several good resources here, both on the evaluation frames, how to do an integrated analysis, which surprise, it's participatory and it involves talking and it doesn't involve software. And then evidence-informed policymaking kits. This is really important so that you actually start communicating your lessons and your recommendations in a way that it gets as easily possible plugged into this cycle, decision-making cycle at the health authority. So step 6, I guess this is the favorite with this, the second one with the yellow, the yellow mark. So supporting healthy behaviors and resilience to misinformation, both at individual, community, and societal levels. So what would be the 3 truths that we put together here? And again, what does it actually mean to put communities at the center? And here's, you know, our view on this. One is that, and we all know this, that engaging communities through infodemic management is really critical, but this really is really going beyond just listening or one-way communication. And communities really need to have a role to play in infodemic management. And in my point of view, they're the key for long-term resilience to misinformation and for promoting healthy behaviors. So we discussed in class a lot. There's different kinds of communities, and don't be afraid of engaging them, both to author, edit, and publish and share content to address misinformation. This is what Liz mentioned already earlier. If you're thinking about the fact that the content is actually going to have, you need to start thinking about defining content and producing it, not only so that it's going to be branded by the Ministries of Health logo, but actually think about it in how you can actually deliver it to as many people that have the reach and support what you're doing, so that they can repurpose, adapt, and forward it further. So that means that, you know, the rules of actual not just countering, but content dissemination are completely different now in the age of what I was showing you earlier, like what in session 3, in the age of emotional web 5.0, right? So don't consider crowdsourcing, consider really working with large numbers of people. This is something that we do in other parts of our life online all the time. And there's no reason for us to not get comfortable, start getting comfortable with these approaches as well. But at the same time, you know, I was speaking now as far on the online side, you also will need to have make extra efforts to reach out to those communities that are unnetworked or closed, whether they're online or offline. And though that's really an important aspect, do not forget about that. And a second piece here, involve communities from A to Z, from design, development, and also implementation of any of the projects. Otherwise, things are going to fail. I keep saying to my digital health colleagues, infodemic management is a use case where all of the human-centeredness principles from technology, and all of the participatory design and use principles are just like on steroids. We really need to be putting people and communities at the absolute center of everything that we do, or at least think about if we cannot. The second truth related to communities and in this piece is that, yes, I mean, it comes down to trust. It came out also in the Elnor lectures. And this is another list quotes. There's a direct relationship between the amount of trust communities have and the access you will have to these communities. So you as a newcomer to the country, you'll be building relationships with individuals and also with communities. It is a process, and you need to show a human, really human connection to people. I mean, this is what we've experienced also over the last 4 weeks in the course, where you know, even though we're so socially distanced, we're all connecting individually from our workplaces or homes via Zoom. We actually made that human connection, and look at what kind of community we've established. And these are all the types of things on a very human and personal level that you also need to keep doing, both as a professional, but also when thinking what kind of interventions and what kind of engagement and relationships you would like to have with communities. Lastly, here on this point, when we're talking about resilience of communities, in the end, what we're trying to achieve is that the communities will not rely solely on health authorities to receive health information or to get corrections of misinformation. This may be something that is very, it can cause unease because, you know, some people are still talking about there needs to be, you know, sole and authoritative sources of health information, where health authorities have a role to play. But if we want to achieve true resilience or to misinformation in the information ecosystem, actually that becomes federated completely, and communities and individuals are resilient because of where they're connected and their social linkages and their information networks are actually resilient to this. Liz, do you want to comment on this and then do the third one?
Yeah, you know, the bottom line is that you really need to create an ecosystem and support an ecosystem. When you have communities answering their own questions, organizing their own infodemic management approaches, and having a real stake in the larger infodemic management structure that a health authority is trying to execute, then you know you're winning. And what's really true and important here is, again, thinking about participatory approaches and building resilience. It's a process, and so this is also something really hard to do if there's no trust and there hasn't been a community-centered approach previously. So most importantly, to echo what Neville says, go where the people are. There really needs to be strong linkages between communities and health authorities, and that means offering more ways in which questions can be asked and answered, and then available in multiple formats and languages, and tailored for specific groups. So the best practices here, really, there's many of them, but understand the social determinants of health in communities and vulnerable populations. So recognize that there's a lot more that is impacting people's day-to-day lives beyond, you know, the narrow health issue that you're worried about. And build those insights into your interventions, and then consider the limitations of, again, only being able to measure the tip of the iceberg. And, you know, that online offline behavior gap is really, really hard to measure. So think about novel data collection techniques that can be used to fill this gap. And then this is really important. Make sure the interventions that you're introducing are not exacerbating or strengthening the equity gap between digital, gender, health, or other perspectives. Again, human-centered design, if you leave nothing else, if you forget everything else from this lecture, the human-centered participatory approach is something that really should be advocated for strongly. One size does not fit all in development of messages and interventions. I think that much is clear. And you can think about social marketing techniques here, and pairing messages with behavioral interventions, because guess what? Messages by themselves are usually not sufficient to promote behavior change. Louder for those in the back. Messages by themselves are usually not sufficient to promote behavior change. And then ultimately, you want to use community level indicators in regular health system reporting. So there already is a ton of data being collected on a regular routine basis. What are some existing data sources from that set that you can use, or one or two indicators you could suggest adding? And that is going to get you a lot further in understanding community level impact of the work that you're doing.
And just to add to this, you know, from my background in health information systems and work in health analysis, we at global, regional, sometimes even at national level are totally blind at the type of data sources that we actually have available about the communities within the country, because you literally need to go look for them and within that country. And that's what I was saying, that, you know, when it comes to monitoring, there's you have to also be thinking from the bottom up. If you actually really want to be understanding what's happening in the communities, you also need to be doing the research. And when you arrive to the country, look for what kind of routine data sources are already there. This is usually quite overlooked. And there may be assumptions made that that things don't exist, but actually they do. And health service delivery data sets on many different in many different programs may actually have things that they already have collected on routine basis. You need to really go look for that. And that's as equally important as trying to get a nice and simple number to the minister in measuring a particular national indicator. You will need these types of operational data for your work. We collected all kinds of resources here for you. Again, I think it's going to be some clicking and reading that you can dive into. So we're down to the step 7, and then we have also the 8, the overarching one. So the step 7 was, as you remember, is about strengthening, in the end, strengthening the outbreak preparedness and response in acute health events. And what you're emphasizing here is that you then make sure that all that you're learning and the lessons learned from the interventions, that all of that is then really applied to future preparedness planning policy and systems. So second thing to get out of all of our lectures and the course, you're building the systems. Leave the country and the process is better than how you find them when you arrive to the country. And that's key. It's really key. We tend to invest, especially when, you know, there's a huge push to solve a problem, to then really look only at products, but we really need to build the systems. So what have we come up with for you for 3 truths regarding this? Right, so one thing is, don't just do your good technical work, make sure that you synthesize it and that you keep actually informing all of the different stakeholders and decision makers with what you've learned. So if you ended up, you know, doing good work, but you didn't actually communicate it and you didn't make the efforts to build it into policy, that's an opportunity lost. So it really is your job that you make sure that after your deployment to the country or, you know, involvement in a project is completed, that the infodemic management lives beyond that. So make sure that you build systems, make sure that there is documentation, even though perhaps they may not be asking you for documentation. Make sure that you provide and institute processes so that policymakers are briefed about what you're doing, and as part of an integrated public health response. It's really, this is really key. It's also important to note that why is this, that this type of work is also going to help you advocate for budget allocation. So you need to have evidence and you need to show why what you're doing is important before you can really start asking for systemic or even, you know, more investment in what you're doing. So some people may even think that because you're only thinking about infodemic management, which, you know, takes place, the infodemic takes place online, there's free and online tools, therefore you don't really need a budget. You really need to advocate and about what infodemic management goals are and what it takes to actually present it. And as we've shown several times, and I think we're going to also show it later on, you need to present infodemic management on par with epidemic management. So policymakers already understand the phases of epidemic response, what are the different kinds of tools and the toolboxes that they have available to them, they're comfortable with that. So if you make parallels to this is how infodemic management and practices and frameworks can actually complement the epidemic surveillance and response, it will allow you to actually make that link and make a connection to a policymaker that perhaps, you know, is in any case quite overwhelmed with the types of decisions and asks that they get. Neville also touched on the third one in his message. You do need to talk about infodemic management in a very different language when you're speaking to policymakers. What they usually care about is very different than what you're thinking about as a technical person. So you may need to restructure your conclusions or insights in such ways that a policymaker would understand and they can connect it to their top priorities. So there's different ways of how you can speak with policymakers. It's not just what you experience today, a pitch to the minister, but you can also host policy dialogues, which are a really good way of synthesizing and opening up discussion, writing policy briefs and involving policymakers in intervention design and also in policy brief writing. Liz, would you like to comment on this one and then take us to the next?
I think you did a great job covering it.
Okay, so best practices.
Yep. Build alliances with not your usual suspects. Infodemic management really does require a whole society response. P.S. There's even going to be a big WHO meeting on this next month. That's about exactly this. You really need to build working relationships with the tech sector, medical associations, librarians, academia, fact-checking, media associations, and different groups will require different levels of engagement, but it's really important to start early and to reach out to them often. Set your data and insights free. Again, if you want more people to feel ownership over the infodemic management process and feel invested in the process, you need to also share out what you've learned. And so you can publicize those insights and recommendations broadly. This is also really critical if you're collecting data from a community. You need to go back to that community and express exactly how that data has been used and what the insights are. And so you can plan for public feedback sessions to validate your insights and offer ways for public and communities to give comments and feedback. And this is my favorite one, concretize. This is a term I heard a lot in Afro. And I think it's a really great word to describe, like, how are you taking the processes that you have innovated and making them more permanent and building them into structures. So you're creating a space for infodemic management work. And that can be including regular reporting and public engagements and creating that norm that infodemic management insights are, really critical to the general public health response, and that policymakers and others should be briefed on it regularly. And then you can kind of embed that into modules and indicators to other aspects relevant in the response. So just to say, it's helpful to start thinking about how do you not only create this regular rhythm of infodemic management insights, but also create processes by which you would have infodemic management be a space where people can expect additional insights and recommendations on an ongoing basis, and not just when you're in town. So lots of tools and resources.
Yes. Actually, not to give them credit, I literally put Africa Infodemic Response Alliance in Mafindo. They're famous, and IRA is just being established. You just saw one of their health literacy project products or during the break. Look for them. And actually, Mafindo will be speaking at the WTO conference next week, actually. About community engagement. Lots of learning resources related to this as well. So the last part, and Liz, we only have maybe another 15 minutes for everything else that we need to say, including the WTO stuff. So
let's blast through it.
To say. Well, we'll blast through it. So what's then really important is that you keep that principle. So the principles that we were talking about, adapting to the changing needs, both of the populations and also of the response. And at the same time, you build capacity. And literally what we're talking about now just goes through all of the steps. It's a continuous loop. And So make sure that you are a part of that loop, or that you facilitated feedback, insight back into action in any part here. I mentioned this already earlier. Document what you're doing, because no one else really will, especially in an emergency. But you know, we can only build the ship while we're flying if we actually are starting to build the blueprints as well and write them, so that we can replicate the ship soon. Really do keep in mind that sometimes a solution for infodemic management sometimes will require a systems change to fix. So you won't be able to achieve that on your own. You will have to be an educator at the same time as a technical expert, and you'll be in situations where you'll have to support capacity development and understanding in a broad range of colleagues that you work with. So if you identify a barrier to successful infodemic management that requires a change in health systems, either in service delivery or in policy, be clear and do recommend it. This is an added value. Infodemic managers will tend to see things that vertical programs or even integrated service delivery program might not. And that's really important. Best practice, Liz, over to you.
Infodemic management box does not exist on the organogram. It's so cute when we hear it's like, well, where is the infodemic management index, and what is the TORs in the job description? Where would the organogram exist, and what would it doesn't exist. You got to build it. And the best way you can build it is by helping your colleagues being successful and building, basically concretizing infodemic management into existing related strategies. And then targeting your population's information needs that will change over time, and that you'll need to adjust your planning. You don't want to be using the same insights that you discovered in June, in November, or December. So it's also important to drop the things that are no longer serving you, including indicators that might no longer be relevant. You also want to consider how infodemic approaches can be integrated, particularly in improving health service delivery. Ultimately, health workers are still the most trusted source of health information, which means that the infodemic is going to be particularly acute when it reaches health workers. So how can you help health workers do a better job of addressing concerns, addressing misinformation, and reassuring patients and communities to follow health guidance and advice? And so there's a lot there that you should be able to unpack.
So right, we also compiled tools, resources, learning resources for you, and a couple of other points. And again, because we don't have time, we can discuss this in a different format. Keep in mind that when you do work in a country, first of all, you'll need to fill the most essential gaps. And this is Liz and I take on what would be the minimum required activities that needs to take place as you're starting to build systems. So if you see gaps in those, make sure that you really invest in those. So at minimum, we need to do social listening and delivering high quality health and information, and we need to be countering to misinformation and disinformation. But as you'll see, there's 4 other things in addition. And this is where the aspect of building resilience and building systems really is reflected in. And I won't go further into this, but this could be a really nice discussion further, and we can find a way maybe in our community of practice to discuss. I also won't go very much into detail here, but I did put it in the presentation because for those of you that perhaps have noticed, WHO is organizing already over the course of November, and towards a final event on the 11th of December, a whole of society infodemic management conference. It's actually a 3rd big event of the year on infodemic that we've organized. And one of the things that we asked to do for one discussion track, which had to do with country experience and health authorities, was a preparation of a poster, a digital poster. But really, what really that poster was asking about is almost like a rapid assessment checklist for infodemic response readiness. And I won't go into the detail. I have included all of the things that you could consider in these elements in the slides following. But really, if you're trying to very quickly assess the environment, that would help you figure out how you then, what parts of that process that we were talking about are taking place and what are not. This can help you do that rapid assessment. So it has to do, with coordination resourcing. It has to do with integrated measurement research and data analysis. How are the different interventions actually designed and implemented? How are the experiences integrated into decision making, and of course, what are your working relationships across society that are supporting all of this work? And so this checklist, we hope that it will help you when you think through and identify where potential opportunities for collaborations and work are, and what you're building in this. So we have already, this is a repeat of the slide we've already shown you in session 3, and the bottom line, you are the ambassadors for infodemic management, and I won't repeat this because I'd actually like to, in 10 minutes, we actually need to close and go to closing speeches, and I'd like to just add to basic information about what comes next after the training. Liz and I studied all of your questions on Miro, and we hope that actually we captured most, if not all, of your questions in this slide deck. Now, we didn't discuss into the detail and specifically get to them one by one, but we actually did some time thoughtfully searching for the resources, etc. You're very free to contact us with any specific questions in addition, and we'd like to also talk to you about what we can do together as a community following the training. Catherine Kane raised her hand. Catherine.
Hi, I'd just like to sneak in before anybody disappears. I would like to propose that we briefly turn on our video or audio to give the learning team a huge round of applause for their efforts. Sorry to hijack.
Okay.
Hey, great.
You guys are fabulous.
You guys are fabulous, and sorry that we've been speaking now for an hour. We just wanted to unload all of the other stuff we still had to tell you.
Thank you, all of you. Thank you.
Thank you.
Thank you.
Oh, wait, there's still more.
Don't go anywhere yet.
Thank you.
Oh.
Thank you. You are special.